Um, so just to introduce first our three talks. This is Tim Phillips. Tim leads our work on the value for money of health and social care, and he's going to explain some very recent work we did auditing the long-term plan for our health workforce. So over to you, Tim.
Thanks very much. Very nice to be with you all in this impressively large horseshoe. Yeah, so I'm going to talk about what was the English Health Services, the NHS's first ever, or certainly first for a very, very long time, workforce strategy. I'll describe a bit about what the workforce strategy and our study was about, and also what we found, but I'll focus a bit more than I would with a normal audience of non-professional auditors on how we did our work. And hopefully that will be interesting for you. It required us to work very differently to how we normally would. In fact, it's a way I hadn't worked before in 19 years doing value for money in the NAO. So first of all, the thing to say, I think, is that the long-term workforce plan document that the government, the NHS, published back in June 2023 is a very long document, 132 pages. It attempted to set a strategic direction for the long term in terms of training more people, retaining more staff within the health service, and reforming how different professions within the health service work. But really, our work on the strategy came down to one thing, which is this table. I don't expect you to be able to read every number on it, but to an unusual degree, the engine at the heart of the whole document. The numbers in there drove all of the other decisions. Basically, how to increase education and training of new NHS staff so that there would be 130,000 more of them starting to train by 2031. And then eventually by 2036-37, these 130,000 would flow into the NHS and work there. And that would help to increase the workforce from 1.5 million today, or a couple of years ago, to 2.3 million, really enormous workforce. So our job was to examine the complex modelling that led to this table, to open up the engine, if you like, take it apart, and then see if we could put it back together again. It wasn't a typical project for us. First of all, we take advice and soundings about what people think we should look at all of the time, but it's very rare for government to ask us specifically to carry out a particular piece of work. But in this instance, we were approached, Gareth was approached in the first instance by the Treasury, and the Treasury, the Department of Health, and NHS England all asked us to carry out this independent review of the modelling that underpinned the long-term workforce plan. And our key questions really were, does the modelling operate correctly? And is it a reasonable basis for strategic workforce planning in the long term? So models are, of course, something we come across all the time in our work. In financial audit, we examine some very closely each year, but more typically in our VFM work, in my experience, we end up using the outputs of models that government has produced. So a good example would be when I was Director for Education, we often looked at teacher numbers, and the modelling that the government has would show that it needed X thousand new physics teachers each year, but that it was actually only training X hundred new physics teachers. And we would use the output of that model to hold the government to account for what it was doing. We don't tend to kind of pull models apart quite so often in our VFM work because the scope of the studies is sufficiently broad that we need to look at a whole range of things. So this instance, the only job of the work, the only job of the report was to look inside the modelling and see how it worked. We had published a couple of years ago a framework to review models, and this is the kind of picture from it here. And in this instance, while in some studies we might only dip into one or two of these 8 areas, in this instance we looked at every single area, controls, risk assessment, etc., in order to understand what kind of a model the NHS had built to create the strategic picture of the future workforce and how well it had operated it. The work was important and high risk, and that's not least because no one outside the NHS had seen the model before we looked at it. And that includes no one in the Treasury and no one in the Department of Health. And that might help to explain to you why they wanted us to come and look at it. So briefly, what was the model? In the run-up to doing the work, we were told, we'll get you the model, we'd like you to see the modeling. And when we got it, we discovered it was actually a pipeline of many different models that had effectively been bolted together, which is part of what made the work complex. So the NHS England, had 18 pre-existing input models, which told them how many doctors they would get, how many nurses they would get under current conditions, and allowed them to vary some things. They then built a new Python model, a model in the Python code, which calculated what would happen in future if they improved retention or improved the productivity of staff. And then they took the outputs from that into a process that they called triangulation, which was in Microsoft Excel, where they tried to minimize the gap between what they thought they needed in future and what they would get. And that's where they added in the extra training and university places. And then finally, in a separate set of Excel models, they constructed the ranges that were in the table that I showed you at the beginning. So a complex modeling pipeline. I'm going to touch on our main findings now in order to illustrate some of how our methodology worked in practice and what we used it to do. It's important to say that the modeling and the plan are a significant achievement and a foundation for the NHS to build upon. But the modeling pipeline, as many of you will have guessed just from the previous slide, is inherently risky. And then additionally, the absence of documentation on the NHS's part meant we couldn't replicate the reported outputs. And I'll say a bit more about how we discovered that in a moment. Many model assumptions were optimistic, and there was limited communication of the inherent uncertainty of the future, or alternative scenarios for how the NHS might develop in future. And finally, the endeavour was completed very much internally to the NHS, internally to NHS England. And that meant in order to make good assumptions, it would have been good if they had consulted with professional bodies, royal colleges of medical practitioners, but they hadn't really had that sufficient engagement. So really, in publishing this document, they were publishing what they would like the future to be, but without a good degree of certainty that some aspects of it were achievable. So we ended up being very critical of the modelling, but we really didn't want to suggest that the endeavour itself was pointless. Unusually, to an unusual degree, I know this is something as auditors that we all face, but to an unusual degree, we had to walk a fine line between being frank and plain about the problems in the modelling, but not discouraging government from doing anything like this ever again. Because for years we had felt, like many experts, the lack of a long-term workforce strategy in the NHS. And so we didn't want to say, you know, this is so problematic that really it would be better that future politicians would think it was just better to close the door on it and walk away. So that was something that we really thought long and hard about. And just here, there's a kind of, you know, example of why it's pretty obvious, I think, but why it's important. It takes a long time, a lot of money to train medical staff and nursing staff. And so you need to know a long way in advance what you think you're going to get at the end of the process. And then secondly, here, the approach that had been taken up to date, which was largely not an approach, just kind of what happens and some announcements about individual professional groups, had led to a situation where both before the pandemic and then after the pandemic, to an even greater extent, there were lots of vacancies, a reliance on temporary staff who are more expensive and obviously less dependable in terms of the continuity of their employment. We have very low staff morale in the NHS, according to its own annual surveys of the workforce. And then finally, what this reveals is we've had rapidly rising overseas recruitment, so a dependence on things that we don't control. And what you can see here is that the number of newly registered nurses has gone up steeply in the UK over the last decade, but only the red maroon bar is our own homegrown nursing. So all of the increase really has come from taking nurses from overseas, ready trained, which has both reliability issues in terms of continuity of supply and also ethical issues in terms of one of the richest countries in the world taking people who have been trained in places which may have even greater shortages of medical professionals. So the two-stage approach to the modeling, the Python code, then the Excel, brought big problems to the modeling endeavor, and especially when combined with incomplete documentation. Our modelers in the analysis hub in the office, which was part of the joint team that we built, so there were people from the health value for money team and people from our analysis hub, our modelers focused on this technical aspect of the modeling, and they tried to reperform what NHS England had done. And we wanted to see if we could get back ourselves to the numbers in the published tables. With the Python part of the modeling, the NHS had not written adequate instructions, so nobody coming afterwards could reproduce what the model had done on their own. But when we interviewed NHS officials who'd been involved in it, we were able to reproduce the government's outputs. So basically, the Python model wasn't perfect, but it was quite good. And with improved documentation, it would have been adequate. But Python was only the first step. The triangulation in Microsoft Excel was key to getting to the published numbers. And here we couldn't reproduce the numbers at all. And this was really important because Excel was where the university and extra training places were added in to the modeling. So what you can see here is the light blue line going up through the middle of the graph is the future demand for adult nurses. The dark blue line that comes underneath is the future supply of adult nurses at the end of the Python modeling. So not adequate. And it's only when you get to beyond the triangulation part of the process that you get to the red line, which gives you enough, or in some years more than enough, adult nurses in future. The Excel models were built of hundreds of different switches, toggles in Excel, for different years, for different types of intervention, for different professions. And the NHS modelers were encouraged by the officials in charge of them and by ministers to run those models hundreds of times, right up until just a few days before the document was published. And what essentially had happened was that they didn't keep a record of which switches were on and which switches were off for the final chosen run of the model that was used to make the published figures. As you can imagine, this was a difficult discovery for us during the study because it made clearance very difficult. It's a kind of difficult message to get across. And the NHS initially disagreed with us, but then its own modelers tried to reproduce what they had done and they couldn't do it either. And the gap was really large in places. So for doctoral students, for medical students in future, 17% difference between what was published and what they found when they tried to redo it themselves. So that's what our analytical hub people did. On the other side of the house, the other part of the team, we focused in the health part of the team on the assumptions in the model. And this is where long-term familiarity with health really became essential to know what is and what is not a reasonable assumption. We found that there was optimism bias in many areas. There was an assumption that higher education could be expanded to the maximum thought necessary without any consideration of failure rates of students if you expand how many you take in, or the willingness of independent universities to build new premises for additional nursing and medical education. There was an assumption that the productivity of health output could be increased above the long-term average in every single year of the long-term workforce plan. And then finally, there were some kind of quirks in the modeling which had been introduced in order to get to the desired outcome, the outcome that ministers had wanted and officials had wanted. That included saying that the UK would no longer, or England would no longer recruit any doctors at all from abroad by 2034. But that's implausible. We looked and it seems that only North Korea has no inflow of doctors trained from abroad internationally. And also, it isn't actually the NHS which controls who recruits a doctor, it's individual hospitals. Explicit assumptions we looked at, but we also looked at implicit assumptions, things that just had been taken for granted throughout the modelling process. One of which was assuming that it would be possible for taxpayers, for the government to afford to pay all of these doctors and nurses in future. Basically, that the model of the NHS would just expand without having to shift. Similarly, with regard to hospital estate, the assumption for visits to accident and emergency, so visits to emergency rooms, was that it would increase from 23 million a year to 41 million a year in 12 years' time. But that doesn't just mean you need more doctors, it means you need more emergency rooms. And so is it really feasible to build that many? Is that the plan? And then we also saw issues with the pattern of GP growth, and that's what this graphic shows. The long-term aspiration, as in many health systems, to move healthcare out of hospital into the community. But according to the long-term workforce plan, the number of consultants would grow like the red line, so the number of people who normally work in hospital at the moment, and the number of general practitioners, GPs, who normally work in the community would really not change over the life of the plan. And we thought that was strange and perhaps something that hadn't been intended. So finally, to finish, what did we learn? It really felt like one of those times when you're glad that you're in an organization that values expertise and maintains niche skills. I think only 2 of the people on our team had heard of Python coding before, but it was lucky that we had someone in the office, or not lucky, it was by design that we had someone in the office who was an expert in Python coding. Similarly, having an existing framework to use was useful, not just to guide us in doing the work, but tremendously useful in clearance when we came under challenge from officials about why we had decided to comment on a particular area of their activity. We were able to say, well, that's part of our framework for looking at models, and we've published that, we stand by it. Hybrid team, we had a large team for NAO VFM work by those standards of 9 people, and we met at least twice a week right through the project, which lasted for almost a year. And we were constantly sharing emerging findings with one another. But the thing that we found was it took a long time to understand the right weight to put on findings coming from the 2 parts of the team. We didn't speak each other's language. And so that was something we learned for the future. And then finally, problematically, it would be nice sometimes in order to be able to take some things for granted. And I've certainly lifted things from government modelling before and just used them in order to start an audit or build some fieldwork. But this really showed me that you really shouldn't take any government modelling for granted. Thanks very much.
The report, what were their comments to the audit?
Sorry, just say that again. So that their expert modelers knew that many of these weaknesses were present in the modeling. Of course they did. They were professional modelers. From their point of view, it was about the pressure of time they had been under to produce things quickly. So they developed a plan to change the models in future if they repeat the modeling, which they plan to do every 2 years. So we were glad about that. I think at a higher level, there was some incredulity that assumptions for the future should be documented so thoroughly that you couldn't just say, a minister told us that this was how they wanted it to be, that really you need to be able to document it if someone coming afterwards is to understand your rationale. Thank you very much.
Phil's going to be picking up the topic that we discussed last night, which is he's going to reflect on the first report that the NAO carried out on the UK government's use of artificial intelligence. So thank you, Phil. Over to you.
Thanks very much, Gareth. So, yeah, I want to talk about artificial intelligence. So I want you first to imagine just what artificial intelligence could mean for public services. So just imagine what it would mean if public services were as effective, efficient, personalised, and as accessible as the mobile phone in your pocket. What would that seem like? And, you know, there's great claims made about artificial intelligence and how it's going to transform public services, whether it's from revolutionising healthcare through to transforming transportation systems, or even streamlining administrative tasks like project delivery. So there's lots of hype around AI, and there is very little information that was known about how government in the UK was using artificial intelligence. So I was part of the team that wanted to pull back the curtain on what was going on in government, what was deployed, what was being piloted and planned, what some of the barriers were. And we wanted to make some recommendations so that the government could improve the situation. So it's worth setting this in context. So artificial intelligence isn't something that is entirely new. It's been around for some time, and the government has been talking about AI and encouraging its use for many years. So back to 2018, if you cast your mind back to then, we've had sector strategies, we've had guidance, we've had frameworks, we've had reviews, we've had plans, we've had new bodies set up, for example, the Incubator for Artificial Intelligence, and we've had lots of funding announcements and various initiatives announced by the government over this time. And many of these in recent years have been made around the time of fiscal statements or fiscal announcements like the budget, which is happening today. So I think that just shows how much importance really that the government has been placing on AI. And really, you know, why is that? Why is the government so interested? Well, it comes down to a number of things, including money. And, you know, the government has talked about the tremendous potential benefits of artificial intelligence for productivity, for example, or reducing costs or improving services. And in fact, they did some analysis which suggested that around a third of civil servant tasks could be automated and improved with AI. And so with that prize in mind, and all the talk around transformational benefits, it was interesting for us to find out what the reality was, what was going on across government. So we did a large-scale survey because no one knew, no one could tell us what was going on. The central government couldn't tell us. Individual departments weren't clear what was going on in their own individual organizations. And of course, the private sector, big tech companies only knew what they were involved with themselves. So we set out to do a really large scale survey, and it was a large survey. We went to almost 90 government bodies, including central government, non-ministerial bodies, and also a selection of arm's length bodies, which actually captured about 98% of that spend by these arm's length bodies and agencies in total. And what we found is just over a third of organisations in that sample, and we had a 98% response rate as well. So it's a very good high response rate there. We had around 30% of those organisations, around 37% that had AI actually deployed in their organisations. And I'm not talking about random civil servants tapping into ChatGPT on their own bats. I'm talking about properly organised and deployed AI within these organisations. A similar kind of proportion were piloting and planning AI in their organisations as well. And in total, we found something like 74 individual use cases of AI actually deployed within government departments and other government bodies. So that was on average around one or two per organisation, and many, many more in the pipeline. So some of the examples, just to make things a little bit more concrete, there were examples of the tax authority using an AI-powered digital assistant to help taxpayers understand what they needed to do and and to get advice. We had the Land Registry. This is an organisation that records property transactions and a lot of detail around those. They were using document comparison tools powered by AI to find discrepancies in different documents that could otherwise slow down property transactions. We also had Natural England which was using AI to use image recognition of satellite imagery to classify different types of land and habitats, so they didn't have to survey in detail the whole country. So lots of examples, and there was many, many more that were piloted and being planned. Everything from detecting fraud through to AI that was being used to match people up with cases. There's a lot of case management that goes on in governments, and lots of examples of coding assistance as well. So being able to translate programming languages from one language to another, which is quite useful for those programming languages where there's not really you can step right in those languages. So lots of examples, and of course, you know, those standard ones that we're all very used to, which is, you know, using ChatGPT and other generative AI to produce maybe slide packs or documents and so on. So we're all familiar with that kind of thing. So it's worth thinking about what we found in terms of why they were using it. So one of the interesting things from this chart is that there are mostly, and I should say that this survey was done around a year ago, just less than a year ago now. And remember, if you cast your mind back, generative AI like ChatGPT or Google's Gemini and so on, they were only just breaking onto the stage that year. So there was a lot of uncertainty around how the public would take to AI, whether this they would see this as a threat, whether it be seen as trustworthy and so on. So perhaps linked to that, a lot of government bodies were actually using AI more internally, so to support decision making, maybe also to help with research and monitoring, or to improve the internal processes and streamline things. But very little of the AI that was deployed or planned was about directly interacting with members of the public. And maybe that's no surprise at that time. And I imagine that more as time goes on, more of this will shift towards the right, which would be around members of the public, for example, as trust is established. Now, in terms of the impact, so what it was too early really to understand what impact it was actually having in practice, in reality, but we could certainly establish from our survey what impact was being expected from AI, not just the AI that was being deployed already, but also what was being planned and in the pipeline. So primarily, government bodies talked about service quality and improving service quality. They talked about reducing costs, cost reduction through AI and automation. They talked about speeding up services so that services could be delivered quicker, the processes were quicker. Just imagine, you know, passports and so on being all enabled by AI empowered processes. They were also talking about new ideas for public services, but this was much less important at that stage. And personalization, and I was talking about personalization as one of those great hopes for AI and public services, and many other ways of transforming the services that are given and provided to the public and also businesses and others. So lots of impacts that they were talking about. And in terms of the findings, I want to just introduce some of the things that we found. So we found that there was a lack of a coherent plan across governments. So there was no one really also with the oversight and the accountability, lots of confusion about who was responsible. So some of these things are changing now, but at the time you had parts of the Cabinet Office, so the Central Digital and Data Office, who were responsible for assurance, aspects of assurance around AI, but they were only interested in what was going on inside of government, whereas another department, Science and Technology, they at DCIT, they were looking at the whole picture. So, but primarily what was going on outside in the market, although they also had an interest in what was going on inside. So it was all very confused. And that was something certainly that needed to be cleared up. And there were parallel governance arrangements. And we also discovered that you know, AI and implementing AI, of course, is very similar to digital transformation, and government was not even learning the lessons from that, and they needed to implement those lessons. And of course, a lot of analysis that goes on in government, a lot of processes that run in government are running on old, aged, legacy IT systems that were not set up remotely for AI. AI really was not a consideration when some of these systems were put in place, and they need replacing anyway, even just to keep operating. And there was a lot of call for standards and guidance and clearing up what some of the assurance processes were around AI. And when we looked at what the barriers were experienced by individual organizations, we found issues like skills, that perennial issue of getting the right people with the right skills in the right numbers in the right place. And they're really struggling with this, not only because the private sector was also interested in exactly the same kind of people and paying quite a lot for them, but also they were competing amongst themselves within government and for the right people. And some of these people were working on legacy systems and cleaning up data as well. So they were all important issues, and they were potentially being dragged away to work on AI. Data issues, data sharing, data quality, they were issues too. Accessing funding for some of the experimentation and trials that organizations wanted to run. And also one of the things that people were really concerned about was legal liability. What happens if things go wrong? Are they on the hook? Is central government on the hook? Who's responsible? So these were all issues, and many more besides, but these were the issues that were coming to the fore. So we had a number of recommendations. One around having an integrated plan that matched the ambition that government had for AI in public services with the reality and the levers and the various incentives that you need to make that happen. And we wanted them to look at test and learning and how they were sharing lessons so that people were not trying to do the same thing and making the same same mistakes over and over again. They could learn from each other, and they could scale up some of the smaller scale tests and pilots into something more wide scale and promising. And of course, we wanted them to keep on the focus with legacy systems and tackling those, and not be disrupted by the promises of AI, but leaving legacy systems alone. They need to stop that, and data, and very much more aside. So I think to sum up, there's potential that people see, government sees, but there's a reality check because it's not widely used across governments. And to move from that, from the kind of reality of it being something which is only really getting started, I suppose, you go back to those kind of third of government organizations that had AI deployed, you need to move to impact and scale things up in a responsible and sensible and planned way. But to do that, you need not only to tackle the technological issues around the tech debt, but you also need to transform business processes to take advantage of the changes that you make. Okay, thank you. Yeah, sure. So the government has made a number of statements over the last few years about potential billions of pounds of savings over various periods of time, based on a number of different assumptions around, whether it's central government, whether it's the wider public sector that we're talking about savings, but it's none of the calculations that we saw were very very detailed. They were based on, for example, identifying tasks that were done and some assumptions made around those, and so on. So there's a lot of uncertainty around it, and billions is basically the kind of guess that David was making at the time. This was the time last year. Yeah, exactly. Nice link.
To cast your minds back, if I could, to January of this year, when Gareth gave a presentation to our Parliament. He was an early address, and then he said that it's good work, the government can achieve more with what it already spends. He gave some examples, so little snippets in his speech of where government is being suboptimal in its spending. So he talked about the government major projects, and only about 8% of them have evaluation plans. So that's the riskiest and most innovative projects, and less than 1 in 10 have any plan to work out whether or not they've achieved what they wanted to achieve, and indeed what went well and what went less well. So that doesn't sound quite right, but that's a fact. He also talked about the health service, where they spend money on goods and services, about £6 billion a year, on things like rubber gloves. And they have a procurement system in place that helps them get value for money from that, but almost half of the spending doesn't go through that procurement system. So again, that doesn't sound right. And the last area Gareth talked about was fraud and error. So the important word here is reported fraud. Since the pandemic is about 10 million or not going to people that deserve the money and should have the money. And again, that doesn't sound right. So during the course of this presentation, I'm going to explain a little bit about why this is all important, but I suspect I'll be preaching to the choir, as they say. I will talk about what we aim to achieve with this piece of work, and I'll also say what we found during this piece of work. So why is this important? Well, in the UK, we, the public sector, spend about 1.2 trillion per year, and that's general spending on things like infrastructure, but it also covers things like pension payments and servicing, servicing our levels of debt. That's the spend, but there's also the demand side of things. I'm sure you can resonate to this. People are getting we also know that it's a whole system approach. That is going to take. Also know that in the UK, at least, tax levels and borrowing levels are at historic highs. So it's quite difficult to spend more if it's more difficult to tax. And unless you get the growth, which in the UK is stagnating, then you have a real challenge. So that's why it's important to make public money work harder. Gareth, after his speech, took me to one side and set my team a challenge. And it sounded very easy to say. It wasn't as easy to deliver as it is to say. But Gareth wanted us to go back through our entire back catalogue, focusing on the last 5 or 10 years, and think about the incoming government. And that could be a new government, it could be the same government, but think about an incoming government and what would we say to them based on our back catalogue? If we looked through all of the evidence, all of the insights we have, and said, here's how you make public money work harder, what would we say? So the challenge Gareth set me was to collate and curate all of our learnings, all of our lessons in one place, in a document that he could share with ministers when they took up the post, and say to them, these are the critical things you need to focus on. And that leads to the second bullet in this presentation, which is Gareth didn't want us to look at everything. He wanted us to look at the priority areas. He also wanted us to stick to our principles, as you would expect. So he wanted us to think about the whole system. We are very able to look across ministerial departmental boundaries. So we get that overarching view. We also don't just look at a single parliament, we take a long-term approach and we think about things from a sustainable perspective. So we take a long-term view, and we're also focused on governance and good financial management. So that was the task that Gareth set. And as I said, this is the output. But it'd be worthwhile saying that I think, Gareth, you won't mind me saying that you were inspired by the Bundesrechnungshof's output in 2021. I apologise for my pronunciation, which did something very similar. And Gareth thought, well, let's, as our chairman says, let's deal with pride. Let's make sure that we bring the best of the Supreme Audit Institution faculty and make sure that we do the best we can with the insights we have. So what did we find? Well, in our report, we looked at 5 what we call areas of opportunity. So as I mentioned earlier, Gareth asked us to focus on the big ticket items. So the first area we looked at was delivering major infrastructure projects. We said they needed to be delivered well. And in each of the boxes underneath, we've got the lessons that we think government should take from our work. So why is major projects so important? Well, I mentioned at the start, the riskiest and most innovative projects in the UK, projects and programs, number about 244. And that's £805 billion worth of total life cost. And we have varying degrees of success in the UK on delivering major projects. So HS2 is one where we haven't been so successful. But these major projects are essential to deliver government policies intent. So if you can get also waste them with money. And the lessons we've identified, I'm just going to pick three: being clear on what you're trying to achieve. Start at the outset identifying exactly what problem you're trying to solve. Be transparent and honest, and that's a cultural thing. Be transparent and honest about what you're trying to achieve, where things might go wrong, and if they do go wrong, what you're doing to address them. And finally, recognize that these things are big and complex and uncertain, which means once you accept that, you're a much better place to deal with it. So that was the first area, major projects. Second one, looking after your assets. In the UK, just the government estate, so that's hospitals, schools, government buildings, are worth about 500 billion. And we know that it's really important to maintain those, and sometimes you have to replace those. And what we've seen over the last few years, certainly since COVID, since the financial crisis, and also since the energy crisis caused by the invasion of Ukraine, we have noticed that government is being quite short-term in some of its decision making, and that means it's an easy tap to turn off is the maintenance of public buildings. That's very easy to defer that till later, but if you defer that, that gives you costs further down the line. So that's not necessarily a value for money decision. So we've said that what you need to do is understand the asset condition and the consequences of those assets failing in terms of public service delivery, have a plan for maintaining those assets, and where necessary, have a plan for replacing those assets. So that takes me on to the third area, better buying of goods and services. And I gave the example on the health patch earlier, which Tim talked around. But in the UK, we spend around £400 billion a year on goods and services, which makes procurement and the way government procures incredibly important. You want to get as much bang for your buck. You want to make public money work harder in that area. And government's own calculation says that if they could improve procurement just a little bit, they would save between £4 and £8 billion a year. So we said one of the lessons is make better use of competition. When you're going to use the private sector, compete, build capability and capacity, have the right skills and expertise to enable you to go out in the market and negotiate those contracts, and also be transparent where there might not be a market to compete. You have to go to a sole supplier because that itself creates challenges, and one should deal with those. So that was the third area. On to the fourth area, and Phil's presentation touched on this, digital transformation. Digital transformation, moving away from paper to computer, making use of what's in your phone, will make public service delivery much better, much more efficient, much better for the user. And the lessons we've identified are to understand what legacy IT systems you have, make realistic plans about how you're going to replace them, and make sure you've got the skills and expertise to deliver. And that takes me on to the fifth area, fraud and error. I mentioned recorded fraud and error around 11 billion, 10 billion, slightly more than 11. We know that in the UK, the tax and the welfare ministries have a good idea of their level of fraud and error. Lots of other government departments don't. There's a thinking that maybe 2/3 of the level is underreported. And so what we should do, and the lessons we've identified, is you've got to assess and identify the potential fraud and error. You've got to bake into the systems a way of detecting and defeating fraud and error. And you've also got to make sure that everything's aligned with your risk appetite. And I'm conscious of two things. Firstly, I made that sound very, very easy in terms of you just got to fix these things. Second thing I'm conscious of is Gareth asked me to speed up slightly, which means that when I go on to the next slide, enablers of better productivity, I'm not going to go through the detail of this slide, but I will highlight that, as Phil said and Tim said, you need robust data. The workforce plan, that was all about robust data. Without robust data, you can't make good decisions. Without the right leadership skills and culture to succeed, and that's from the top of an organization all the way down to the bottom. As Phil said, how are you going to deal with AI if the private sector has all of the good staff and you don't? That will increase your procurement costs, increase your consultancy costs. You need to have what we refer to as a sustainable approach to planning and spending. That's thinking longer term, that's setting budgets. We're all keen to see what the Chancellor is doing later, because she has said that investing in infrastructure are going to be absolutely critical to government delivering their policy intent. And we also know that government needs to innovate. They can't do the same thing with the same amount of money and expect a different result. So they need to take risks, but they need a very clear idea of the risk appetite. And we know that success takes probably quite a lot of failure through innovation before it's achieved. So that takes me back to my second picture of Gareth. It's the same as the first one. But going back to his speech, there is good evidence from ENAO's work that government can achieve more with what it already spends, because we already spend 1.2 trillion a year. There's a challenge because we can't really increase taxes too much. We can't really increase borrowing too much. We've got stagnant growth, and there are all those demands in the health sector because of an aging population, and also the demands of future generations through climate change. So hopefully I've stressed the importance and given you a whistle-stop tour through our findings. But this report is available online, and very happy to chat through it to you if you're interested.